Hello, I underwent a functional nasal surgery 3 years ago, and as a result of complications from the procedure, the upper lateral cartilage and nasal septum became misaligned, making it impossible for me to breathe properly. The reason I am uploading this video is to share information with people who, like me, are unable to breathe due to complications from nasal surgery and to seek solutions to this problem. Over the past 3 years, I have visited many university hospitals and tried my best to gather as much information as possible. In June of this year, I underwent revision surgery at a plastic surgery clinic. However, the improvement I experienced after the revision surgery only lasted for 2 months. My nasal cartilage reverted back, and I am once again unable to breathe properly. I have also visited various ENT clinics. While a small number of doctors have acknowledged the issue and admitted that it would be difficult to fix, most doctors ignore the problem entirely. They tell me there's nothing wrong, often in a dismissive tone, as if they're avoiding the issue altogether. Some even suggest that it might be a psychological problem rather than a physical one. In this situation, I decided to upload this video to vent some of my frustration and, more importantly, to share experiences and gather information from others who may have gone through something similar or who might have relevant knowledge. I live in South Korea, and here, people suffering from symptoms similar to mine are in the same situation. Most doctors either fail to recognize the issue or dismiss it outright. Worse, they sometimes label the patient as mentally ill instead of addressing the physical problem. I hope that my video can provide some help, even if only a little, to others in similar situations. Now, let me explain the current state of my nose in detail. Now, before I explain the details of my nose condition, I'd like to briefly talk about how to interpret CT scans. Reality is three-dimensional, but the visual information we get from a CT scan is two-dimensional. CT scans take three-dimensional spatial information and present it in three different 2D perspectives to make it easier for us to understand. Let me explain these three perspectives one by one, using geographic coordinates as an example. Imagine someone standing upright and facing the North Pole. In this scenario, height represents altitude, east-west direction represents latitude, and north-south direction represents longitude. Let's apply this to the CT images. First, the top left image is the coronal view. You can think of this as looking at someone's face directly from the front. The blue line represents height or altitude. The red line represents the east-west direction or latitude. Next, the bottom left image is the axial view. Think of it as looking at someone's chin from the level of their navel. The blue line in this view represents the north-south direction, or longitude. The green line represents the east-west direction, or latitude. Finally, the bottom right image is the sagittal view. This is what you see when you look at someone's face from the side. The green line in this view represents height, or altitude, and the red line represents the north-south direction, or longitude. In these CT images, you'll notice red markings. When I color a specific area in the top left axial view, corresponding areas in the other two perspectives are also marked with a red line. This indicates that these regions represent the same location in different views. Similarly, I've added blue markings. When I highlight certain areas in blue in the axial view, the corresponding locations in the other two perspectives are also marked with blue lines. The reason I've used red and blue lines is to emphasize the position of the nasal septum in both the axial and sagittal views. For those unfamiliar with CT scans, it's easy to mistake all the structures shown in the axial view as representing the nasal septum typically thought of as the pillar of the nose. When combining the four CT images with the red and blue lines, you can see that the axial view shows more than just the nasal septum we commonly think of. It also displays structures extending deep into the nasal cavity and even to the upper throat. The red marked area represents the space where the commonly understood nasal septum, or pillar of the nose, is located. The blue marked area represents the deeper internal nasal septum closer to the throat. Now, let's focus again on the axial view. At first glance, it may seem like there is enough space for air to pass through because the lower sections appear straight and there are visible black spaces indicating open airways. However, when considering the red and blue lines, the nasal septum near the blue line is straight and does not obstruct airflow. However, the nasal septum near the red line is severely deviated, with almost no visible open space. This means the commonly understood nasal space marked in red is completely obstructed, while only the deeper space marked in blue near the throat remains open. In this sagittal view, the general airflow path is as follows. Air enters through the nostrils, rises upward, moves eastward, and finally descends near the throat. Given this, the argument made by some doctors that you can still breathe fine because the blue marked space is open is absurd, even on a basic level of common sense. It's like saying there's no traffic congestion on a highway where an accident has caused a massive jam simply because the roads before reaching the accident site are clear. CT scans of individuals with complications like misaligned or collapsed upper lateral cartilage often show the following pattern. The internal nasal septum, deep within the face, is straight. However, the external nasal septum, or pillar of the nose, is significantly deviated with no visible open spaces.
The CT scan on the left was taken in July 2021, a month before my surgery. The CT scan on the right was taken in March 2022, after experiencing complications that made it impossible to breathe. At first glance, the nasal septum in the right image appears straighter than in the left image, which might suggest an improvement in breathing. However, considering the distinction between the nasal septum in the nasal cavity and the deeper nasal septum within the face, as well as focusing on the black spaces representing open airways in both images, the situation becomes different. When I underwent revision surgery this year, the surgeon informed me of the following. The area where the septal extension graft and the septal support were placed had shifted downward, causing the upper lateral cartilage to collapse as well. If you focus on the nasal septum in the nasal cavity in the right CT scan, you will notice almost no black spaces and thick white cartilage occupying the roof of the nasal cavity. Even with this comparison via CT scans, it's challenging to fully grasp the situation without seeing it in 3D. Therefore, I created 3D models based on these two CT scans to provide a clearer understanding. CT scans store three-dimensional data as DICOM files and present them as three types of two-dimensional images. Using a program called 3D Slicer, I was able to create 3D models based on the three-dimensional coordinate data stored in the DICOM files. Now, let's compare the two 3D models directly. First, here is the 3D model created based on the pre-surgery CT scan. The left nasal cavity appears extremely narrow, while the right nasal cavity shows some space. I sustained trauma to the left side of my nose when I was 15, causing it to become deviated. For 10 years, I struggled to breathe properly, and finally underwent nasal surgery at the age of 26, 3.5 years ago, to improve my breathing. Next is the 3D model based on the post-surgery CT scan. Comparing it to the pre-surgery model, there is no improvement in the left nasal cavity, and the right nasal cavity has become significantly narrower. Particularly, the cartilage protruding into the roof of the right nasal cavity has blocked the previously open space. Now, let's revisit the pre-surgery 3D model. This time, please focus on the direction of the nasal septum. To aid understanding, I inserted a rod-shaped model aligned with the direction of the nasal septum. Although the left nasal cavity is very narrow due to trauma, the nasal septum itself is aligned in a relatively straight direction. Here is the post-surgery 3D model. Similarly, focus on the direction of the nasal septum. You can observe that, in addition to the cartilage protruding into the roof of the right nasal cavity, the nasal septum is no longer straight. Instead, it appears collapsed, leaning towards the right side of my face.
The term deviation of the nasal septum does not seem appropriate. Rather, I think the term misalignment of the axis of the nasal septum is more suitable. Now, let me summarize today's video. Based on the CT scans, when distinguishing between the red area, which represents the functional nasal septum, and the blue area, which represents the internasal septum, the nasal septum, which is the sole entry point for air during nasal breathing, is severely misaligned, with very little space available within. When comparing 3D models generated from the CT's DICOM files, there is little to no change in the space of the left nasal cavity, though the roof appears slightly even lowered. In the right nasal cavity, there is a protrusion of cartilage near the nasal roof, which entirely blocks the previously open airway. Furthermore, while the nasal septum was relatively straight before surgery, it appears severely misaligned after surgery, with the axis itself clearly tilted. Therefore, compared to the state of my nose before surgery, as well as based on the current CT scans, I can conclude that it is difficult to breathe through the nose. In the pathway for airflow during nasal breathing, which includes the nose, the internasal turbinates, the throat, the trachea, and the lungs, the nasal septum, which serves as the entry point for air, is so severely misaligned that there is insufficient space for air to enter the nasal cavity. Thank you for watching this long video. I felt deeply frustrated while making it. Until now, I had never compiled such concrete evidence. However, every time I physically felt the protrusion in my right nasal cavity with my hand, or when I experienced significant air friction at that protrusion while breathing, I was constantly aware of these issues over the past 3.5 years. Despite this, there were doctors who claimed I had no issues while yawning in front of me and dismissively told me to leave. The doctor responsible for ruining my nose even mocked me with a sarcastic tone, saying that there was nothing wrong with my nose and that the problem must be in my mind. Because of this, I felt so angry while creating this video that it was hard to think about anything else. In South Korea, there are many people in situations similar to mine. Those with collapsed upper lateral cartilage are often told that there is no structural issue with their nose and are instead labeled as having psychological problems. Such dismissive or mocking remarks from doctors are common. If this video can provide even a little help to those people, it would mean a lot to me as well. With this, I will conclude the video. Thank you.